So good morning, good afternoon, and good evening. Thank you for joining us today. Before we get started, just a few logistics. To select your preferred language, please click on the interpretation icon on the bottom right of your screen, the one that looks like a globe, and select your preferred language. And from your mobile phone, you can do this under meeting controls. You'll press the three dots and then press language interpretation, and you can select English or French. Most of the presentations today will have French subtitles. Otherwise, simultaneous translation will be available. Please take note that when a presentation has translated subtitles, there will be no additional simultaneous interpretation. So for today, we encourage you to use the chat to ask questions in English or French at any time to the group or directly to any of the moderators if you need technical assistance. We'll be using Mentimeter today. You can use this on your phone, tablet, or laptop, and we'll provide instructions on how to access and use Mentimeter in a few minutes. QR codes and links via the chat will be provided throughout the webinar for you to access resources and tools. And the webinar recording, presentation, and links to resources will also be shared by email. To get us started, I'm very excited to first turn things over to Foyeke Oyedokun-Adegbabo, Project Management Specialist for SBC in the Health, Population, and Nutrition Office at the USAID Mission in Nigeria. Foyeke, good morning, and over to you.
Thank you, Amanda, and I hope you can all hear me okay.
Yes, we can. Thank you.
Thank you. So good morning, good afternoon, and good evening, everyone, depending on where you're joining us from. It's really great to have you here with us today. Thank you for taking the time out of your really busy schedules to be a part of today's event. I'm very pleased to be able to welcome you to the third event in a four-part series of legacy and learning webinars that have been organized by Breakthrough Research. For those of us who may not be so familiar,
merci de vous joindre à nous. Pour ceux qui ne connaissent pas très bien Breakthrough Research, nous travaillons sur la recherche et l'évaluation du comportement. Nous sommes basés aux États-Unis et nous promouvons la recherche innovative pour enseigner la programmation. Ce projet a été implémenté depuis août 2017 et se poursuivra jusqu'en juin 2023 et il est conduit par le Population Council en collaboration avec nos partenaires, notamment l'Université Tulane, Avenue Health Population Reference Bureau, Institute for Reproductive Health à l'Université Georgetown et IDEAS 42. Breakthrough Research travaille en collaboration avec un projet sœur qui s'appelle Breakthrough Action avec d'autres partenaires de mise en œuvre qui travaillent sur le changement comportemental et social et le changement du comportement des prestataires. L'objectif est d'encourager la collaboration et de se rassurer que les projets CSC sont fondés sur ce qui marche. Et nous essayons d'accroître l'impact des projets de CSC. USAID investit au Nigeria pour la planification familiale et depuis plusieurs années, nous nous fondons sur la preuve que au-delà des déterminants sociaux et cognitifs, il y a d'autres facteurs directs et indirects qui ont des impacts positifs et négatifs sur l'adoption de la planification familiale et des résultats liés à la planification familiale. La réunion d'aujourd'hui nous aidera à mettre en lumière certaines leçons tirées sur comment les approches CSC sous-tendent et accompagnent les programmes de planification familiale. Nous sommes rassurés que les conditions dans lesquelles les gens travaillent, les conditions dans lesquelles les gens sont nés, les conditions dans lesquelles les gens grandissent et leur âge, qu'ils ont accès aux ressources ou pas, que les conditions économiques soient convenables ou pas, les politiques, les régulations, les finances, les structures de gouvernance, tous ces éléments sont interliés et permettent de mettre en place un environnement propice. Ceci peut être modulé par le CSC, les approches CSC pour se rassurer que les individus, les communautés et les foyers s'engagent dans des approches CSC volontaires. Ces systèmes sont au cœur des projets de l'USAID et nous avons pour objectif de créer un changement durable et soutenable. Je vais donc passer la parole à Laura, qui est le project manager, le responsable de projet de Breakthrough Research. Merci de vous joindre à nous. Merci, Foyer K. J'aimerais souhaiter la bienvenue à tous. Breakthrough Research a travaillé pendant 6 années et a
The project has worked in 19 countries and engaged with 21 global and country partners on 53 research studies. This has resulted in 27 peer-reviewed publications and 94 citations to date across the 4 priority technical areas of the project.
Donc, nous avons 4 domaines prioritaires du projet: le changement comportemental, le CSC, faire avancer la mesure et le coût du CSC. Le webinaire de ce jour, c'est le 3e sur 4 webinaires sur l'héritage et l'apprentissage. Ces webinaires ont pour objectif, ou alors visent les programmateurs, les chercheurs et les bailleurs de fonds, et l'objectif est d'apprendre. Donc, joignez-vous à nous pendant le 4e événement du CSC. Nous souhaitons la bienvenue à ceux qui étaient déjà là pendant les 2 premiers webinaires sur les approches de CSC et le changement du comportement des prestataires, et également sur la planification familiale. Si vous avez raté ces deux webinaires, vous pouvez accéder à ces webinaires à travers le lien qui est partagé dans la discussion. Ce webinaire porte sur les leçons apprises pendant les 6 dernières années pour accompagner et mettre en place un environnement propice pour le CSC, et également pour améliorer la conception des programmes de planification familiale. Premièrement, nous allons commencer avec un cadre propice pour le CSC, et à travers des présentations courtes, nous allons partager les preuves de haut niveau de Breakthrough Research produit au cours des 6 dernières années pour accroître la compréhension sur comment le CSC crée un environnement propice et comment cela, une compréhension accrue pour accompagner la planification familiale. Nous allons également partager des appels à l'action sur les mesures à prendre pour l'avenir. Et nous allons passer la discussion et aux questions-réponses. Je vais passer la parole à Amanda, directeur technique de Breakthrough Research. Merci beaucoup. Comme nous avons dit dès le début, nous allons utiliser Mentimeter, ce qui vous permettra de donner votre avis. Si vous vous êtes joint à nous, ce serait très facile pour vous. Mais pour ceux qui se joignent à nous pour la première fois, vous pouvez accéder à Mentimeter à travers votre téléphone ou votre laptop. Si vous utilisez votre téléphone, utilisez le code QR sur l'écran et vous serez redirigé à Mentimeter. Et dans votre téléphone ou ordinateur portable, vous pouvez aller à Mentimeter et entrer le code que vous voyez, 44538355, et vous serez redirigé sur notre page à Mentimeter. Nous allons vous donner 1 minute pour le faire, et si vous êtes là, vous pouvez lever le pouce pour nous indiquer que vous êtes là, et cela nous permettra de connaître le nombre de personnes qui se sont connectées à Mentimeter.
Great, I'm seeing some thumbs up. I'll give people just another few seconds to get here.
Je vois quelques pouces et je vous donne encore quelques secondes pour vous connecter. Nous voulons être sur la même page.
Wonderful.
Très
Okay,
bien.
so we're going to go ahead and get
Nous allons commencer avec les questions Mentimeter. Tout d'abord, utilisez cette carte pour indiquer d'où vous vous joignez à ce webinaire aujourd'hui. Placez ce bouton sur votre emplacement géographique et nous pourrons voir les résultats, nous pourrons voir d'où vous vous joignez à nous pour ce webinaire. Merci.
Wonderful. It's great to see colleagues from so many different locations.
Nous avons les collègues de plusieurs locations à travers le monde et c'est un plaisir de vous avoir aujourd'hui. Nous allons aborder la prochaine question. Alors, utilisez-vous les approches de CSC dans le cadre de votre travail? Dites-nous oui, non, ou alors si vous ne savez pas, ou alors vous n'êtes pas sûr. Utilisez-vous les approches CSC dans le cadre de votre travail? C'est ça la question. Très bien, la majorité, oui. Il y a des gens qui disent non, il y a d'autres qui ne savent pas. Et comme nous évoluons, vous en aurez davantage d'informations. Alors, la prochaine question. Quelle est la composante d'un environnement propice que vous connaissez dans votre travail? Par exemple, la législation, les finances, ou alors vous travaillez sur les facteurs socio-économiques, ou alors les institutions, la gouvernance collaborative, les institutions de gouvernance. Donc, quelles sont les composantes que vous utilisez dans le cadre de votre travail?
Great. So it looks like about half working on social and economic.
Donc, la moitié travaille sur des facteurs sociaux et économiques, les autres institutions, gouvernance, gestion, politique, législation et financement pour les uns. Et nous aimerions également savoir les personnes qui se joignent à nous. Nous savons d'où vous venez, mais est-ce que vous vous considérez comme un concepteur de programme, un chercheur, un donateur, un concepteur, metteur en œuvre de programme, ou alors responsable de suivi et évaluation? Aucune de ces catégories. Choisissez la catégorie à laquelle vous appartenez. Nous voyons que nous avons un public assez varié. Chacun trouvera son compte. Merci pour votre participation. C'est notre manière d'avoir votre avis, de savoir ce que vous faites. Et merci pour votre participation et nous y reviendrons très prochainement. Tout d'abord, nous allons parler de la CSC, du CSC et d'un environnement propice.
Family planning programs are often faced with the challenge of transferring knowledge into behavior. A wide variety of contextual factors influence the conditions for action and non-action. An enabling environment for voluntary rights-based family planning brings together three interrelated groups of practices: policies, legislation, and financing, institutions, governance, and management, and social and economic factors. Given the link between individual and community level beliefs in myths and misconceptions that can impact the use of modern contraception, a supportive enabling environment understands and addresses knowledge gaps, myths, and misconceptions through education, particularly girls' education, and through interventions such as information campaigns that can seek to improve knowledge and dispel those myths. Understanding what and who influences attitudes, norms, and beliefs, and what sources of information are trusted by women and men can help to shape how SBC programs and interventions are delivered and through what channels. Additionally, community engagement that promotes a more supportive enabling environment for family planning acceptance and use should address norms around family planning, norms around communication and decision-making, and gender norms that affect men's attitudes and their engagement in decisions related to the use of family planning, while also respecting women's autonomy. We can then further think about this enabling environment and its intersection with SBC approaches. The interaction within this nexus, here in the overlap of this diagram, can go both ways. The enabling environment can act on SBC approaches in a way that facilitates or creates barriers, while SBC approaches can identify areas where the enabling environment could be strengthened and then work to create a more supportive environment. Over the course of the next hour or so, we'll share what breakthrough research has been doing to further unpack this intersection of SBC and the enabling environment. To do this, we'll be sharing just a selection of our work over the past 6 years, organized around key messages we'd like to leave you with. The links that we provide throughout the webinar can be used to go deeper into the evidence shared. We'll also share a link at the end of the webinar to a collection of a larger body of breakthrough researchers' work on SBC and the enabling environment and on integrated SBC, where much of this work is derived from. A first key message for today. SBC approaches can best support family planning programs to achieve their goals when the context of the enabling environment is clearly defined and measured, better elucidating the pathways by which behavioral determinants influence health outcomes. To dive a little deeper into this key message, we'll highlight some of the evidence that breakthrough research has generated over the past 6 years, outlining different ways SBC and the enabling environment interact, and how this deepened understanding can help to support family planning programs. You'll hear from those on the breakthrough research team involved in developing these resources, and they will be available at the end of the webinar to answer questions. Over to you, Sanyukta.
Greetings, colleagues. My name is Sanyukta Mathur, and I'm a social and behavioral scientist at the Population Council. I've had the pleasure of serving as the technical advisor on gender and youth on breakthrough research, and led the process toward developing research and learning agendas on 2 programmatic themes that emerged as key priorities in the SBC field: provider behavior change and integrated SBC programs. At the start of the project, in collaboration with USAID and building on past efforts, we took an intentional, consensus-driven approach to develop global SBC research and learning agendas. We engaged over 190 partners in this process, including researchers, implementing partners, service delivery organizations, as well as donors. The RLA for Advancing Integrated SBC Programming lays out a set of questions to prompt the generation of knowledge that advance efficiency and effectiveness of integrated SBC programs. In this RLA, experts identified implementing in an enabling environment as a key evidence gap, in addition to questions about intervention content and programmatic model, effectiveness of the integrated approach, and costing of the integrated approach. The RLA discussions touched on how the enabling environment needed for integrated SBC programs is different from more vertical programming and the limited evidence available on this critical component. The RLA thus articulates 2 broad primary research and learning questions on this topic. First, what are the conditions, for instance, political or donor support, capacity and coordination, that enable or hinder design for appropriate and feasible implementation of integrated SBC programming? And second, what are the conditions that enable effective adaptation and sustainability of integrated SBC programs? Lessons generated from the research and learning questions to fill these evidence gaps about the enabling environment have applicability across a range of health areas, including family planning, for strengthened programming and sustained outcomes. Please scan the QR code to learn more. Thank you for listening.
Thanks, Sanyukta. And next over to Leanne to share with us some highlights.
Merci. Nous passons la parole à Léane pour parler de l'environnement propice.
Hello, my name is Leanne Doherty, and I will be sharing some of our evidence to inform integrated social and behavior change in the Sahel. Governments and donors in the Sahel recognize the need for strengthening state and local institutions and governance, increasing sustained economic well-being, and improving health and nutrition. Interest has grown in the viability of building upon existing humanitarian and development assistance to cohesively address more than one health and development issue within integrated programs. Breakthrough Research conducted a literature review to generate evidence for integrated social and behavior change in the Sahel. Findings from the evidence review helped to identify persistent knowledge gaps, myths, and misperceptions and norms that influence health behaviors. The review found that many of the health behaviors included in the review are practiced by women but are influenced by their parents, husbands, friends, and community leaders. Family planning programs that seek to address family planning in the Sahel, including through integrated programming addressing multiple behaviors, need to determine how to influence these audiences by understanding how information is shared within communities, including which sources of information are most frequently accessed and trusted, and how these figures of influence can be engaged to support adoption of priority behaviors. You can learn more and access these documents by scanning the QR code to access the web link.
Thank you, Leanne. Given the identified evidence needs and review of the literature just shared, we know that an enabling environment for sustainable SBC and family planning programs promotes and incorporates structural, community, and individual drivers of change for a more complete understanding of the pathway from knowledge to behavior. Breakthrough Research has generated evidence under 2 portfolios of work, one in Niger and one in Nigeria, that have, in part, helped to better clarify the intersection and interaction of SBC and the enabling environment. To explore this evidence, you'll hear from those on the Breakthrough Research team involved in those studies, and they'll also be available at the end to answer questions.
Hello, I am Adolo Aisiri, Director of Research, Evaluation and Knowledge Management in the Abuja Office of Breakthrough Research. To fill in some of the evidence gaps identified through the research learning agenda, Breakthrough Research conducted a 3-year evaluation in Northwest Nigeria of the Breakthrough Action Nigeria project, which is an integrated SBC program targeting family planning, malaria, and maternal, newborn, and child health and nutrition. Northwestern Nigeria is a region with high fertility and low contraceptive use, driven in large part by high fertility norms, pronatal cultural and religious beliefs, misconceptions about contraceptive methods, and gender inequalities. SBC programs often try to shift drivers of high fertility through multiple channels, including mass and social media, as well as community-level group and interpersonal activities. The evaluation sought to assist SBC programs to better tailor their efforts by assessing the effects of intermediate determinants of contraceptive use and by demonstrating their potential impacts on contraceptive use, interpersonal communication with partners, and contraceptive approval. A better understanding of these psychosocial factors can help elucidate where a more supportive enabling environment is needed and how SBC approaches can strengthen that support, e.g. through campaigns that dispel myths or through male engagement activities that seek to shift gender norms. For this study, called the Behavioral Sentinel Surveillance or the BSS study, we focus on women with children under age 2 living within the Breakthrough Action Nigeria program areas in Kebbi, Sokoto, and Zamfara states. The data were cross-sectional, meaning that we had different samples of men and women at baseline and endline. The sample included over 3,000 women, and we used multivariate regression analysis to look at how intermediate determinants such as values, beliefs, and norms are associated with FP outcomes. Now, to estimate what SBC programs can potentially achieve, we simulated the magnitude of improvements in FP outcomes that could be achieved in a world with improved ideation that is, for example, if everyone had correct knowledge and held no contraceptive myths, or if everyone had positive beliefs surrounding FP, or if everyone approved of FP. Now, we looked at these impacts across the different domains of the additional model, which is knowledge and risk perceptions, beliefs, values, norms, self-efficacy, and social influences. From our analysis, we found that values, specifically approval of FP, appear to have the largest impacts in general. For example, if all women approve of FP for spacing, the estimated regression models indicated that contraceptive use could increase by 11 percentage points. Intention to use contraception in the next 6 months could increase by 20 percentage points, and the likelihood of discussing FP with one's husband could increase by 25 percentage points. Achieving ideal knowledge and dispelling contraceptive myths amongst women could also have potentially large impacts, being associated with a greater likelihood of using contraception, a greater likelihood of intending to use contraception, and increased approval of FP. Social influences were far from negligible, influencing each outcome by 9 percentage points or more. Please kindly use the QR code to dive deeper into the evidence.
Thank you, Adelor. To complement the BSS evaluation of individual behaviors and behavioral ideations and influences, Breakthrough Research developed a set of qualitative studies that aim to help answer the RLA questions about the conditions that enable or hinder effective SBC programming. These studies also explored the multiple pathways of drivers, structural, community, and individual, that intersect to affect behavior change, including for family planning program, and the implications of this for program effectiveness and sustainability. Now, over to Adetayo to start off a short series of presentations of the qualitative studies that explored this intersection of individual, community, and institutional influences.
My name is Adetayo Adetunji, and I'm a research analyst at Breakthrough Research Nigeria. One of the first qualitative studies we conducted to better understand this intersection between individual, community, and institutional influences was a qualitative evaluation of Breakthrough Action Nigeria's Advocacy Core Group, or ACG model. The ACG model, as part of Breakthrough Action Nigeria's broader SBC programming in Nigeria, is a formalized structure of social groups that work through key opinion leaders and influences to affect community level health norms and individual behaviors. You see here some of the responsibilities of ACG members, including working to address barriers, wrongful beliefs and misconceptions on RMNCHN interventions, facilitating the dissemination of correct information on RMNCHN interventions, including childbirth spacing through mass media, and advocating to governments, communities, non-governmental organizations, relevant institutions, and other stakeholders for resources and support. My name is Adetayo Adetunji. First, here are some highlights of our findings related to both social norms and to creating a more supportive environment for discussion and decision-making among couples. Although social norms are entrenched, that norms around child spacing are beginning to shift, with a recognition of the benefits to mothers and children's health. However, women do not have the agency to make health decisions and to independently take action to seek care in family planning, pregnancy, childbirth, and childcare. Both women and men viewed men as the decision makers, and women were required to seek permission from their husbands before making health-related decisions for themselves or for their children, reflecting unequal power relations. The decision-making power of men was reinforced by culture, religion, and the dependence on men to meet families' financial needs. There is the perception that it is a wife's responsibility to convince her husband of the need for health services, perhaps through enlisting the support of mothers-in-law, religious leaders, and traditional leaders. To address this, ACGs appear to be fulfilling their responsibilities by actively discussing and encouraging shared decision-making on health matters. This has led to perception of shifts towards more shared decision-making, particularly with respect to ANC and facility-based deliveries. In thinking about the enabling environment, understanding the ecosystem of influencers on health-seeking behavior is also important. Here on the screen is just one example of our analysis of influencers in maternal and childcare in Bauchi State. The influence of others on healthy behaviors is important, but not always consistent across different health behaviors. For example, women in Bauchi State report a great deal of spousal influence on child spacing decisions, but less so for decisions about ANC and immunization, where family and healthcare providers were most influential. Overall, our study found several promising areas for potential impact of SBC delivered through the ACG model to support a range of health behaviors, including family planning. First, ACG members described receiving supportive training from BA on how to mobilize communities, which is beneficial even beyond their roles as health advocates. They further reported that the formalized structure of the ACG program provides a good entry to communities and serves as an important conduit by which district heads can reach those communities, again providing useful community support beyond health. Using a combination of media and mass media is promising. ACG members noted that their work has been bolstered by radio broadcasters transmitting similar SBC messages, lending credibility and support to their own work, reinforcing health messaging and reaching broader audiences. The complementarity between the ACG model and the mass media SBC, a central component of Breakthrough Action Nigeria approach, may warrant further exploration and could serve as promising avenue for future SBC programming and expansion. The ACG model setup appears to support its success. The structure of the ACG model, based on close liaison and social support from government leaders at all levels to mobilize and reach communities of interest, provides a source of intrinsic motivation to ACG members. In spite of the lack of financial remuneration, members feel empowered to do their work, given the strong social connections and support for advocacy. As a result, ACG members may find the work inherently rewarding, a fact that speaks to the overall operability and potential sustainability of the model. And finally, the potential of ACGs to influence health appears to be strong, yet it can vary by geography and health topic. For example, analysis of information flows in Sokoto shows that respondents were influenced by religious or traditional leaders for ANC immunizations and child spacing, with traditional leaders appearing to be more influential than religious leaders. This would appear to indicate that the ACGs in Sokoto could continue to serve as an important source of information and motivation to improve the health of community members. This has been a snapshot of what is a very rich set of findings. To explore this and more, scan the QR code to access the study report.
Thank you so much, Adetayo. And now we'd like to hear from you all again using Mentimeter. So please go back to where you left off.
Nous vous invitons à partager vos commentaires à travers Mentimeter. Revenez à Mentimeter si vous venez de vous connecter, allez à menti.com et insérez le code que vous voyez sur l'écran.
Great. I'm seeing some thumbs up, so it seems that most
Je
of
vois
you
que vous
have
vous connectez, c'est bien.
again.
Vous êtes reconnecté sur Mentimeter.
So now that we've heard about the advocacy,
Maintenant que nous avons parlé des modèle de plaidoyer du Nigeria. La première question, c'est une vérification du pour. Étiez-vous surpris de savoir que les influenceurs sociaux du comportement étaient différents en fonction du comportement?
Right. So it looks like many of you weren't, but there's some.
Donc, la plupart répondent non. Certains ne sont pas sûrs. D'autres, oui. Nous allons avoir plus de détails sur cette question. La prochaine question. Dans une courte phrase, dites-nous quelles sont les difficultés que vous avez rencontrées pendant la mise en œuvre des modèles ACG. Donc, quelles sont les difficultés auxquelles vous avez été confrontés? Vous pouvez écrire une courte phrase et nous saurons quelles sont vos réponses.
Great, lots of barriers here, and I'm seeing some
Je vois beaucoup de barrières et je vois que les thèmes qui reviennent, c'est les normes sociales, les normes liées au genre. Et puis, Adetayo, j'espère que vous êtes en ligne. Pouvez-vous nous dire davantage sur ces barrières liées aux normes sociales, normes liées au genre, également les données que vous avez tirées du modèle ACV.
Yeah. Thank you very much.
Merci beaucoup. Juste une réflexion sur les réponses que je vois. Je vois beaucoup de normes sociales, normes liées au genre. C'est exactement ce que nous voyons au quotidien. Et nous avons plusieurs facteurs au niveau communautaire, au niveau étatique. Et cela est sous-tendu par une variété de preuves tirées du nord du Nigeria au cours des dernières années, comme plusieurs ont dit. Je ne suis pas surpris de ces réponses. Bien sûr, nous espérons que nous pourrons produire des preuves qui pourront vous être utiles en trouvant des solutions pour ces difficultés. Merci. Merci à Adetayo. Merci à tous et à chacun pour votre participation. Dans cette session Mentimeter, nous avons toujours un plaisir de vous écouter. Nous allons revenir sur Mentimeter dans quelques minutes, mais à présent, nous allons passer la parole à Martha, qui va parler des recherches sur l'évaluation et le renforcement des capacités des communautés. Merci.
Hello, my name is Martha Silva, and I'm the Data Strategist and Innovation Team Lead for Breakthrough Research. We conducted a midterm evaluation of our sister project Breakthrough Action's Community Capacity Strengthening approach in Nigeria. This approach was designed to help communities to identify priority health areas and behaviors in family planning, maternal neonatal child health and nutrition, and malaria, and empower community organizations, namely ward development committees, to mobilize resources, enhance participation in health services, and address underlying barriers to improved health. The community capacity strengthening approach also targeted barriers such as restrictive gender norms and promoted joint decision making. This approach also aimed to increase community ownership and sustainability
by developing systems to ensure continued community involvement and participation. The evaluation that Breakthrough Research conducted used a qualitative approach based on a total of 49 in-depth interviews with community committee members, community volunteers, traditional leaders, and local government officials. In terms of early successes, we found that as a whole, community committees are described by all categories of stakeholders as making improvements in health facilities and transportation conditions, and projecting a high level of capacity. Successes we highlighted include facility improvement, maintenance, and infrastructure, as well as acquisition of needed equipment. Social cohesion was evident not only within, but also across committees and community volunteers, which, as you can see in the quote on this slide, describes the different actors like a broom tied together. Trust is a key element contributing to this sense of cohesion, as is transparency and accountability that is expected of leadership within these community structures. Our study report also highlights challenges to sustainability. We found that the resource mobilization strategies that ward development committees have used so far are mostly limited to fundraising within their own membership or other prominent community members. Structural and logistical factors related to difficulties to reach more remote settings also continue to challenge the sustainability of programmatic efforts, highlighting the need to continue to advocate for structural changes from ward or state level authorities. Additionally, local government officials' willingness, ability, and capacity to provide supportive supervision and continued motivation will be key to determine sustainability of the work done under the community capacity strengthening approach and in support of community level social and behavior change. There was a perceived potential for waning motivation after the end of project implementation. Key recommendations include supporting the diversification of committees' fund generation strategies. The study found a limited number of funding strategies with high reliance on self-funding and a potential threat to the sustainability of the community capacity strengthening approach if diverse funding sources are not identified. Secondly, strengthen capacity for addressing a wider range of behavior influences sustaining change, including practicing holding government and other stakeholders accountable to their commitments to support community health and advocacy. Thirdly, further promote female participation in ward development committees and community structure leadership. Social and gender norms restricting the ability of women to serve within community structures and limiting women's healthcare decision-making severely constrain the implementation and reach of sustainability of community action. We have two documents related to this study which you can access through the QR code on the slide and also through the links that will be shared in the chat. The first document is the technical report for this research study, and the second one is a docu-slide, which is an abridged version of the report in slide format. Thank you.
Thank you so much, Martha. And now we'll hear from all of you again.
Merci beaucoup, Martha. Nous aimerions encore avoir vos avis. Nous revenons sur Mentimeter comme d'habitude. Reprenez où vous avez laissé. Si vous venez de vous joindre à nous, allez à menti.com et entrez le code que vous pouvez voir à gauche de votre écran ou alors utilisez le code QR.
Wonderful. Thanks so much for
Très
utilizing.
bien, merci de vous de signaler à travers les pouces levés. Maintenant que Martha a partagé certaines de ses recherches liées à notre étude sur le modèle de renforcement des capacités des communautés Elle a présenté quelques recommandations et quelques trouvailles clés. La première question, c'est quels sont les défis à la durabilité des modèles comme l'approche de renforcement des capacités de la communauté avez-vous rencontré? Est-ce que c'est les finances, la logistique, les ressources humaines ou alors rien? Ou alors aucune de ces catégories. Donc, quels sont les défis auxquels vous êtes confrontés pour rendre les modèles de renforcement de capacité de la communauté soutenables?
Great. So it looks like a fair
Très
number
bien. Les défis majeurs, c'est les contraintes en matière de ressources humaines, les défis en matière de ressources financières également, la logistique, et d'autres ne rencontrent aucune difficulté. La prochaine question, c'est dans une courte phrase, pouvez-vous nous dire quelles sont les autres barrières ou défis auxquels vous êtes confrontés liés au modèle de durabilité comme le modèle de renforcement des capacités de la communauté. Donc, en une courte phrase, donnez-nous dites-nous quelles sont ces difficultés.
Great. So looking at several barriers coming
Donc,
in.
je vois un peu les difficultés. Martha, je suppose que vous êtes en ligne. Pouvez-vous nous pouvez-vous nous faire une réflexion sur ces points et sur les mesures à prendre pour l'avenir? Pouvez-vous nous partager certaines de vos idées? Oui, merci, Amanda. Je pense que ce point est très important. Il est important de savoir que lorsque nous menons ce type de recherche, et même ce type de recherche, et même à la fin du processus, nous ne comprenons pas souvent ce qui contribue à la durabilité. Parce que si vous devriez le faire, vous devriez revenir à ces communautés 1 an ou 2 ans ou 5 ans après la fin du projet pour essayer de comprendre quels sont les éléments qui ont contribué à la durabilité et la possibilité de continuer à mettre en œuvre les activités. Ce qui a contribué au succès de cette durabilité ou pas. L'autre point que je vois, que j'observe dans ces réponses, c'est l'importance d'avoir des efforts coordonnés. Nous comprenons que nous avons des bailleurs de fonds, qu'il y a la partie du gouvernement, qu'il y a des partenaires de mise en œuvre. Donc, c'est un écosystème de parties prenantes assez divers et variés. Donc, nous comprenons que sans une coordination assez minutieuse de toutes ces parties prenantes, il sera difficile d'envisager la durabilité au-delà de la durée de vie d'un projet. Donc, plusieurs pensées, plusieurs cadres sont en train d'être mis en place pour tenter de comprendre et affiner ce système de coordination pour la durabilité. Cela est très important. Merci. Merci, Martha. Merci à tous et à chacun pour votre participation. Ne vous éloignez pas trop de Mentimeter. Nous y reviendrons très prochainement. Nous allons passer la parole à Adetayo pour partager des trouvailles sur l'évaluation du renforcement des capacités.
As a third component and recent addition to strengthening our understanding of the intersection between individual, community, and institutional influences was a qualitative evaluation of Breakthrough Action Nigeria's public sector capacity strengthening approach. This approach, as part of Breakthrough Action Nigeria's SBC program, has 4 strategic objectives. First, support key Ministry of Health units to strengthen coordination, planning, and quality assurance for SBC at national and subnational levels. Second, strengthen public sector systems for oversight and coordination of SBC at national and subnational levels. Third, improve the quality and impact of SBC activities across the public sector by establishing improved systems and data use for coordination and joint planning. And finally, develop mechanisms for ensuring SBC quality assurance and establishing consensus agendas. Using an outcome harvesting approach and most significant change technique, our evaluation of the public sector capacity strengthening efforts resulted in several key findings, 4 of which are highlighted here. The first 3 are organized around the 3 levels of outcomes examined as part of the study, which are at the individual level, organization level, and system level. First, we found that the individual level outcomes were mainly focused on initial actions undertaken to develop health messages and adapt national guidelines to support LD behaviors and improved health outcomes. Next, we found that the approach strengthened training and facilitation, community mobilization, and design and monitoring. We also found a smaller set of system-level outcomes focused on strengthened coordination and guideline adherence. Yet, there were some challenges identified that may be barrier to implementing the skills gained through the capacity strengthening approach, such as illiteracy, resistance to change, financial and mobility issues that may limit what can be done, a lack of data collection equipment for monitoring and adaptation, and conflicting work plans across areas of the public sector that may not routinely talk to each other and coordinate. Overall, several recommendations emerged. The first recommendation was to investigate and address limiting factors that could lead to slow implementation of SBC PSCS activities. An important finding of this study was the small number of outcomes identified in Kebbi State during the activity years under consideration in this study. Compared to other states, Kebbi appeared to be left behind. We encourage the implementers of this approach to look into whether there are factors in the enabling environment that presented enhanced or different barriers to this approach, or whether the barriers might be more process-oriented. Second, coordination efforts should be increased to ensure even greater synergy between state ministries of health and related ministries, departments, and agencies. The findings of this study showed that coordination activities were least implemented. To ensure that MDAs provide stronger oversight and guarantee the long-term sustainability of activities and consequent gain even after the lifespan of the project, is crucial to ramp up efforts in this area. And third, there needs to be a greater focus on individual and systemic efforts to create balance and optimal achievement of the capacity strengthening approach strategic goals. When implemented outcomes were compared using the SBCC ecosystem levels, it was evident that the most project activities occurred at the organization level. While the organization level is critical in the ecosystem, it's equally crucial to increase activity at the system level to ensure long-term ownership of programs and sustainability of project gains. To read more about these findings, please use the QR code to take you to a page where you can share your email address and receive the final study report as soon as it's available.
Thank you, Adedayo, and please do use the QR code.
Merci, Adedayo.
A few more questions to hear from all of you using
Quelques questions encore sur Mentimeter. Connectez-vous sur Mentimeter à travers le code ou alors le code QR.
Great. It looks like some of you are rejoining us again over on Mentimeter.
D'autres personnes se reconnectent à travers Mentimeter. Nous avons parlé des trouvailles clés et des recommandations sur le renforcement, le modèle de renforcement de capacité du secteur public. Alors, des questions à tout le monde. Donc là, nous avons une forme de questions différentes. Mais lorsque vous pensez d'un environnement propice, selon vous, est-il difficile de renforcer les capacités du secteur public à chacun de ces niveaux? Au niveau individuel, au niveau de l'organisation et au niveau du système. Donc, dans votre expérience, est-ce que c'est très difficile? Est-ce que c'est pas difficile du tout? Ou alors assez difficile de renforcer les capacités du secteur public à chacun de ces niveaux? Donc, selon votre expérience. Donc, je vois les réponses pour chacun de ces niveaux. Et nous voyons les réponses en direct.
So as these are coming in, it seems that the system level is staying pretty firm.
Donc, au niveau individuel est prioritaire ou alors est en premier plan au niveau organisationnel. Donc, Adetayo, pouvez-vous nous dire davantage sur cette situation et ce que vous avez observé pendant l'étude?
What people are saying here. Wouldn't mind reflecting for just a minute.
Yeah. Thank you very much.
Merci beaucoup. Je conviens avec ce que vous dites. Ce que nous avons fait, il est plus difficile. Comme nous avançons, la difficulté augmente. Je pense que, d'après nos observations, c'est plus facile au niveau individuel et un peu plus difficile au niveau de l'organisation et encore plus difficile au niveau du système. Donc, toutefois, nous avions plus d'activités au niveau de l'organisation. Peut-être cela a plusieurs causes, mais nous pensons que ça fait partie de la stratégie pour se concentrer sur l'organisation en tant que point de connexion pour l'individu et le système. Merci pour cette réflexion à détail et merci à tous pour votre participation continue sur Mentimeter. N'éloignez pas Mentimeter de vous, nous y reviendrons très vite. Mais à présent, nous allons poursuivre l'exploration d'un environnement propice pour le CSC.
SBC approaches that address barriers that can result in differential exposure to SBC activities can employ more effective and inclusive engagement strategies to foster empowered family planning decision-making for women, couples, and youth. Critical to SBC's successful support of family planning programs is both understanding which channels to use to reach target audiences, and Breakthrough Research has developed several tools you can use for this kind of SBC measurement, shared in last month's webinar, as well as understanding how structural barriers in the enabling environment may impact exposure. For example, economic conditions may be a barrier to ownership of assets that facilitate exposure to SBC campaigns, such as TVs and radios. Or gender norms might result in differential access to who listens to radio or watches TV. SBC approaches to support family planning programs need to align this understanding of these barriers in the enabling environment and the potential effect on their ability to reach their target audience. This nexus of the enabling environment in SBC is bidirectional. The enabling environment can act on interventions to facilitate or constrain their effects, while interventions can work to create a more supportive enabling environment and break down barriers to healthy behaviors. While this is well known, untangling this continues to be a thorny issue and directly affects the very considered trade-offs SBC approaches and programs need to make to support family planning, such as between what is quote-unquote cheapest and what might reach your target audience more effectively. Breakthrough Research has taken several approaches as part of evaluations of SBC programming to inform the campaigns in reaching their target audience. To illustrate this, we draw on examples from 3 of our portfolios of work. Through a household-based survey in Niger as part of our RISE 2 evaluation, findings indicated low levels of access to television, but higher access to radio and mobile phones, though overall still low in all study areas. There were also gender differences. 2/3 of women had not listened to the radio compared to just 1/5 of men. One potential implication of this differential in access to this channel was that radio campaigns would reach more men than women, but that radio could be an effective male engagement strategy. Overall, the main recommendation from these findings was for the RISE 2 program to consider community-based and interpersonal communication approaches. Similarly, through our household-based BSS baseline survey in Nigeria, radio listenership among women was found to be varied across the different study sites, ranging from 24% to 38%, and exposure to other forms of media such as television, internet, and mobile phones was much lower. Awareness of the intervention radio program was significantly lower in the poorest households than in wealthiest households across the study areas. These findings help to suggest that the SBC campaign's radio program may not penetrate to the poorest households that have demonstrably worse health outcomes, and that the campaign would need to assure that additional outreach efforts through other channels or methods, such as household visits or community events, were targeted at these areas, or consider ways to bring radios to communities, for example, listening or discussion groups. And finally, Breakthrough Research used social listening and social media monitoring to evaluate an online SBC campaign in Francophone West Africa. Social media monitoring is a key tool to understanding whether a campaign's content is reaching the intended audience online. This evaluation found a skew in audience reach. 72% of the audience was male, and yet the target audience for the campaign was both males and females. Findings like these are critical adaptive management tools over a course of a campaign to ensure reach to the right audience through the right channels. These examples come from larger bodies of work. Use these QR codes to explore more. Next, over to Leanne and then to Adelor to share how some of this information just shared from baseline surveys in Niger and in Nigeria help to identify strategies for engaging men in family planning.
Hello, my name is Leanne Doherty, and I will be sharing some of our evidence related to employing SBC strategies to engage men in family planning. In both Niger and Nigeria, gender dynamics influence decision-making about health behaviors and outcomes. Social norms and women's lack of agency in decision-making challenge efforts to meet women's family planning needs in the region. Baseline findings from breakthrough research evaluations in both countries suggested potential differential exposure to campaign content based on access to things like radio and TV, and the need to employ approaches that reach husbands and wives to encourage spousal communication around healthcare decision-making. In Niger, implementing partners rely on a variety of SBC approaches to engage men, including community engagement, radio, interpersonal communication through peer group activities, including husband schools. Husband schools are designed to share information through a community-based approach in order to shift gender dynamics by encouraging male involvement in household responsibilities and increasing couples' communication and joint decision-making related to maternal and child health. Qualitative research from Niger found that by employing SBC strategies, such as husband schools, to engage men in Niger, can help men to reflect on their role in health decisions and encourage them to support their wives. As shared in this quote, "Health issues are discussed at almost every moment between my wife and me, especially when we are trained on a new topic at the husband school. The most recent example is that of a delivery that she made at home, and I was very unhappy about this, because my friends from the husband school had asked me why."
Thanks, Leanne. And now over to Adeline.
A key strategy of breakthrough action and the Abin campaign is to create favorable attitudes towards FP and for bed spacing in particular. The campaign has messages that talk about the health benefits of using contraception to space births, both for mothers and for future children. So to see if the campaign was effective, we looked at how exposure to the campaign, that is seeing, hearing, or reading any Abin messages, or being exposed to breakthrough action community dialogues or community health workers, was related to the approval of contraception, both for husbands and wives. We looked at 4 possible scenarios. If neither partner is exposed to Abin, if both are exposed, or if one or the other is exposed. And as expected, we found that approval of contraception was higher if both partners were exposed to Abin relative to the case when neither is exposed. That is, for couples in which both partners were exposed, 39% of wives and 26% of husbands approved of FP. That was an increase of 5 percentage points for wives and 11 percentage points for husbands relative to the case if neither was exposed. And this shows clearly that exposure has benefits. But what was surprising is the importance of husband's exposure on women's attitudes. The likelihood that a woman would approve of contraception was actually highest if her husband was exposed to Abin. That's approximately 42%. But she wasn't. This was even greater than if she alone was exposed or if both partners were exposed. Hence, an SBC approach that also includes men as targets is clearly warranted. The fact that a husband's exposure to SBC messaging is important to a wife's attitude becomes crucial when we look at the effects of a wife's attitudes, meaning a wife's approval of FP, on actual contraceptive use. In this case, we see that a wife's approval of FP is critical to use. Only 5% of women were predicted to be using modern contraception if only the husband approved of FP, versus 21% if only she approved. So, her approval increases the likelihood of using contraception by at least 4 times, but we can do even better. As you can see, the likelihood of contraceptive use increases to 31% if the couple is concordant in their support of FP. That is a 6-fold increase. Consequently, this study shows that SBC programs targeting jointly contingent outcomes in a setting where women have limited autonomy can be more effective if messaging is tailored to both partners and particularly to husbands. Please kindly use the QR code to dive deeper into the evidence.
Now that we've shared some of the state-of-the-art evidence produced by breakthrough research over the past 6 years, let's look forward to the future and what's needed next. Stakeholders, including communities, need to be engaged in the design and coordination of SBC approaches and family planning programs, and investments made in long-term evaluations to ensure collaboration with the enabling environment, promote accountability, and sustain positive change. In particular, community capacity strengthening approaches appear to yield positive outcomes. Yet, to fully understand their impact, particularly on intermediate determinants that can take time to change, support for investments into long-term evaluations are needed. Evaluations that are too short-term in nature risk undervaluing the potential impact of these community strengthening approaches, including on more entrenched indicators. When using these approaches, there must also be mechanisms in place for communities to hold governments and institutions accountable. Second, a clear threat to the sustainability of SBC approaches that engage communities and other local stakeholders and actors is a lack of sustained financing for these efforts, particularly after donor funding ends. Domestic public financing is a key high-impact practice to both allow for the continuation of successful SBC activities in support of family planning programs, and also the funding needed to address community-identified barriers that require monetary resources. Next, agency and empowerment are under-measured intermediate determinants, but a key link along the pathway from knowledge to behavior that can address, shift, and overcome entrenched gender norms that can be barriers to the use of family planning. Clear definitions and identified measures of agency and empowerment are urgently needed, and their routine incorporation into behavioral theories of change for monitoring and evaluation of SBC approaches in family planning programs is vital. And finally, as the focus on integration continues to grow, the evidence gaps identified in the RLA for integrated SBC programming remain relevant. Continued and strengthened understanding of the similarities and differences of the influence of the enabling environment on different health behaviors, and the potential unintended positive and negative consequences of integration will provide key evidence needed to address how improving the enabling environment for one behavior influences other behaviors.
So now that we've highlighted some of what's needed next to continue to advance our understanding of SBC and the enabling environment for family planning, I'm delighted
Donc maintenant que nous avons parlé des prochaines étapes pour la planification familiale, je vais passer la parole aux panélistes pour leurs réflexions. Merci d'être présents avec nous. Pouvez-vous nous parler des bailleurs de fonds et comment les bailleurs de fonds peuvent utiliser ces recommandations pour faire avancer la planification familiale? Merci beaucoup, Amanda. J'espère que tout le monde m'écoute.
To all the presenters for, such rich.
Merci à tous les membres du panel pour ces présentations pertinentes et riches de plusieurs pays, le Nigeria et le Niger, qui ont présenté l'importance des approches de CSC et la mise en place d'un environnement propice pour la planification familiale. Tout d'abord, je dois reconnaître que plusieurs recommandations faites ici sont pertinentes et je conviens que nous avons des opportunités dont nous pouvons tirer parti pour faire avancer ces recommandations. Parlant des finances publiques, qui est une pratique, il est important que les donateurs et USAID continuent à collaborer avec les gouvernements et les programmes pays pour accroître les contributions en termes de montant, mais aussi la valeur sur la planification, les programmes de planification familiale. Plusieurs programmes pays investissent davantage et reconnaissent que la planification permet de réduire la mortalité et la morbidité. Mais nous pouvons faire avancer et progresser cet investissement en parlant des investissements sur les programmes de planification familiale. Au lieu de rediriger les services, au lieu de rédiger les fonds à la prestation de services, nous pouvons également mettre l'accent sur l'établissement ou alors la mise en place d'un environnement propice. Les bailleurs doivent également continuer à investir dans les analyses physiques parce que les pays ont du mal à distribuer les ressources. Les ressources ne sont pas infinies, mais en investissant dans des domaines ciblés, vous pouvez investir et financer des stratégies innovantes de financement. Non seulement au sein du secteur sanitaire, mais bien au-delà, parce que nous savons que l'environnement propice exige une approche multisectorielle, mais également financer des stratégies qui incluent des sources budgétaires et non budgétaires au Nigeria. En plus des financements traditionnels, au niveau national et sous-national, nous soutenons l'inclusion des services de contraception dans notre pays. Et nous avons également des polices d'assurance qui sont disponibles à travers de l'assistance technique et par l'assistance, le soutien de nos partenaires techniques et financiers. Nous devons équilibrer le niveau d'investissement et d'assistance pour que les pays commencent à exécuter les budgets et s'assurer que les budgets alloués soient investis et dépensés convenablement et que nous optimisons les ressources disponibles. Comme vous l'avez dit, une autre recommandation, c'est de travailler avec les communautés et les populations. Cela permettra d'améliorer notre prestation de services. Le point que je voudrais également mentionner, c'est accroître les investissements à long terme pour une meilleure évaluation. Nous en avons parlé pendant les sessions questions-réponses sur Menti à travers l'étude au Nigeria qui met en lumière les limites dans l'évaluation, la durabilité entre 3 à 5 ans. Il est donc nécessaire d'investir davantage après la mise en œuvre pour évaluer quel point de durabilité subsiste et ceux qui ont fané avec le temps. Nous avons une opportunité en tant qu'organisation et bailleur pour être plus flexibles dans nos recherches et nos allocations de finances pour pouvoir travailler sur le long terme et accroître la durabilité, accroître l'autonomisation. Je crois que USAID continuera à jouer un rôle important dans la recherche et à la mise en place des matrices parce que il est important que les organisations continuent à investir et à jouer un rôle clé en définissant les matrices au contexte pays dans lequel ils évoluent. Merci.
Thanks so much, Foyeke. You've given us a lot to think about.
Merci, Foyeke. J'espère que vous avez pu profiter de cette prise de parole. Avant la session questions-réponses, nous allons retourner sur Mentimeter. Donc, retournez sur Mentimeter. Si vous venez de vous joindre à nous, utilisez le code QR ou alors allez à menti.com. Et nous allons avoir notre dernière session sur Mentimeter.
So we've shared what we've been doing. We'd love to hear in a short sentence from you all how
courte phrase, dites-nous comment votre travail dans le cadre de la CSC a permis de mettre en place un environnement soutenable et un environnement qui soutient la planification familiale. Donc, comment votre travail dans le cadre du CSC a permis de mettre en place un environnement propice pour la planification familiale.
You know, it's hard to summarize work in short sentences.
Donc, en de courtes phrases, s'il vous plaît.
Great. It's great to see the diverse work that's happening and for the person that has
Donc, vous nous permettez de comprendre ce qui se passe.
some of the resources shared in the evidence can help make the case for investing in these activities to support the program. So as a final question for today,
La dernière question pour aujourd'hui, en un mot, quelle est la prochaine étape pour le CSC et pour la mise en place d'un environnement propice pour la planification familiale? Juste en un mot.
Great, and as people are filling in their one word for what they hope is next for SBC and the
Donc, je vois les mots que certains mettent. Nous allons répondre aux questions dans la discussion. Donc, si vous avez une question sur ce dont nous avons parlé, n'hésitez pas à l'écrire dans la discussion et nous pourrons répondre. Et les questions que nous ne pourrons pas répondre aujourd'hui, nous les répondrons, nous apporterons des réponses par mail. La première question. Martha a déjà apporté une réponse à ceci précédemment, mais la question c'est quelles sont les recherches qui sont menées 3 à 5 ans après la mise en œuvre du projet pour assurer la durabilité. Et qu'est-ce que les bailleurs de fonds doivent faire pour assurer cette durabilité? Merci, Amanda. Parlant du nombre de temps, c'est difficile de répondre à cette question.
What percentage of research funded is going towards this kind of longer term post-implementation?
Et je me demande juste le temps qui est investi dans les recherches après la mise en œuvre. Mais selon moi, ce qui est nécessaire, la coordination des bailleurs doit être mise en place, une réflexion à long terme sur la mise en œuvre de différents programmes au sein des zones géographiques. Nous savons que le gouvernement est une partie prenante, donc il est important d'avoir des stratégies à long terme, des stratégies plus à long terme sur ce que nous avons à faire, avoir des cours partagés, avoir des évaluations partagées. C'est une pratique qui sera bonne. Je ne peux pas parler au nom des bailleurs de fonds, mais j'aimerais savoir jusqu'où cela est fait dans les entretiens entre bailleurs de fonds. Oui, je ne sais pas si vous aviez quelque chose à dire, à ajouter du point de vue des bailleurs de fonds. Merci, Amanda. Je suis d'accord avec ce que Martha vient de dire. Nous avons plusieurs plateformes de coordination des bailleurs de fonds dont nous pouvons tirer parti pour accroître la recherche dans le CSC. De manière générale, ils doivent être un peu plus proactifs, parlant des agendas partagés, parlant de la mesure, parlant de l'évaluation à long terme. Donc, voilà des aspects durables. Les preuves mettent cela en lumière et appellent pour que cela se fasse au niveau pays et que les gouvernements jouent leur rôle pour minimiser les duplicatum. Merci. Donc, nous avons vu les mots, nous avons un environnement propice. Nous espérons que les discussions d'aujourd'hui pourront faire avancer, faire progresser les prochaines étapes dont vous avez parlé. Nous avons un quatrième webinaire où nous allons parler de tous ces éléments et tenter de comprendre le rôle que le CSC joue dans la mise en place d'un environnement propice. Nous allons répondre à vos questions dans le mail de suivi. Donc, pour finir, nous voulons dire merci à tout le monde qui s'est connecté. Merci d'avoir passé 1h30 avec nous. Vous pouvez utiliser ce code QR pour obtenir le document sur l'héritage et l'apprentissage. Vous pouvez donc plonger dans l'épreuve. Merci beaucoup de vous joindre à nous. Veuillez vous connecter une dernière fois dans cette série d'héritage et d'apprentissage le 19 avril pour parler du coût de la planification familiale. Il nous tarde de vous voir et nous vous souhaitons une bonne fin de journée. Merci.